What is denture stabilization? In today's video, we'll be discussing this little known procedure that can save you money in the long term and replace your missing teeth for life. So if you are missing some teeth now or you have dentures, stay tuned. This video is going to be really helpful. So this is kind of a sequel to my last video. Maybe you saw it. I spoke about the 3 reasons why dentures are a bad idea. You can check out our page and take a look at that if you would like. But the overall concept is that dentures cause 3 main issues. First, they're notorious for being uncomfortable, and many patients don't like the denture paste that's required to keep them in place. The second downside is lack of functionality. Dentures don't allow people to eat solid foods. So it's very difficult to eat things like steak, chicken, apples, potatoes, hard candy, and many things that people like to enjoy on a day-to-day basis. The third drawback was bone recession. Very few people realize this, but loss of tooth roots causes bone recession over time because dentures only replace the upper portion of your teeth and not the tooth roots. Dentures will allow your jawbone to thin over time. This causes a bunch of issues like sinking of the face, accelerated aging, and eventually the dentures will not fit because the jawbone has changed and the dentures over time will not fit anymore. So all these drawbacks beg the question, what's the solution? How can we solve this? What's the workaround then? Most people who get dentures cannot afford the solution of all-on-4 with zirconia arches. This normally goes for anywhere between $20,000 and $30,000 per arch. It's not a relatively affordable option for the majority of people. So at the very bottom of the scale, we have dentures. At the very top of the scale, we have the fixed all-on-4s. The higher quality you go, the better functionality, the better chewing, the better quality of life. But what's the in-between? How can you get the most bang for your buck while also having a better quality of life? How can you get the best of both worlds? The answer is denture stabilization. Basically, this is an implant-supported denture. The dentist will place 2 to 4 implants in your jaw, and the denture will snap onto place on top of those implants. This is really the best of both worlds. The dental implants eliminate virtually all the drawbacks of having dentures. Your bone will be preserved by the titanium roots, and the functionality significantly improves because they are anchored in. Now you can eat steak and not have to worry about losing bone. There's another denture, another lower denture that is anchored on by implants as you see. It is a clip-on, it's a snap-on, it's removable, it's not fixed. However, it snaps onto place using those implants. We see here 4 implants on the bottom jaw, and this is the space where they go, and they snap on. Now you can enjoy steak, chicken, apples, hard candy, other foods that you would like to enjoy. So here are the 2 ways that patients can go about in getting this treatment. For those of you who don't have a lot of funds at hand at the time of your restoration, you can just opt in to get regular dentures. Then a few months later, you can have the implants placed and the dentures altered so they can snap into place. The other option is pretty straightforward. You can just skip getting the regular dentures altogether and you can just go right into the implant retained dentures. Get the denture stabilization right away, and then you won't have to hassle with any of the negative drawbacks. I hope you found this video to be helpful. If you're thinking about getting any type of mouth restoration, go right ahead and fill out your information below. We give all of our implant patients a free consultation to see if they are a good fit. This has been Dr. Badawi with Westlake Dental Care. Later.